Hello everyone, hi, welcome back to my channel. This is Dr. Paramjeet and you're watching Dr. Education. How are you today? And as you all know, I'm a consultant cardiologist in Yashoda Superspeciality Hospital in Delhi NCR, and I make videos on health and healthcare topics. So I have a lot of videos already made on various healthcare topics, including diabetes, hypertension, heart diseases, obesity, weight loss, exercise, cooking oils, asthma, arthritis, etc. etc. Don't forget to check them out on my channel. If you haven't subscribed my channel already, then don't forget to do that, and don't forget to press the bell icon because only then you'll receive the notification of my next upcoming video. So guys, a lot of you have asked me about high blood pressure, but some of you have concerns about low blood pressure. You've probably heard that high blood pressure is a problem, but sometimes blood pressure that is too low can also cause even more serious problems. Blood pressure, as we all know, is the force of your blood pushing against the walls of your blood vessels, your arteries. And each time your heart beats, it pumps out more blood into the arteries, and that's why blood pressure increases at that moment of pumping, which is called as systolic blood pressure. And when your heart relaxes, at that time also the blood pressure does not become zero. It still sustains a diastolic relaxation blood pressure so that the blood keeps on pushing forwards. And usually these two, systolic and diastolic, are written as 120 divided by 80. 120 by 80. So 120 by 80 is the ideal blood pressure. So if your blood pressure reading is 90 by 60 always or below that, then you have low blood pressure. Once in a while, if your blood pressure goes this low, that's not an issue. So, but if it more than half of the times, if it is low, then there is a problem. Now, some people have low blood pressure all the times.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So some of you may have low blood pressure all the time, and if you don't have any symptoms, then this low blood pressure may also be normal. In some people, blood pressure, when it drops below the normal, it can be because of their lifestyle or physiological conditions, and in some others there might be a medical condition behind it, or sometimes medicines. These can be allopathic, homeopathic, ayurvedic, any kind of medications, and yes, they do have side effects. Every single thing has side effects. Even food has side effects. Every single food. Sometimes even water can have side effects. So everything has to be taken in a particular amount. So nothing can be taken as much as you want. Some people have symptoms of low blood pressure when they're standing up too quickly. Now, at that time, they can have dizziness and even fainting episodes, and that's when there is a big issue. So, in any ways, if low blood pressure is associated with fainting or dizziness or blackouts or any kind of discomfort, then there is a problem. You can even go into shock in extreme cases. As we already discussed, certain medicines and substances can lead to low blood pressure. Now, these things are, for example, alcohol. Yes, alcohol can reduce your blood pressure, and over a period of time, it can also increase your blood pressure. So, it's a very tricky thing. It's not good at all. Although they say in a moderate amount, occasionally alcohol shows some good effects, but overall the controlling mechanisms of the body becomes weak. So that's why it's not good to overdo alcohol. The second thing is anti-anxiety medicines. Any anti-anxiety medicine calms you down, decreases your blood pressure. Similarly, antidepressant medicines, most of them also have a side effect of having a low blood pressure. Then, diuretic medications, specifically given for increasing your urine output, can reduce your blood pressure, and that is done by decreasing the volume of your blood and thereby decreasing your blood pressure. Then heart medications, many heart medications, including those used to treat high blood pressure and coronary heart diseases, they decrease blood pressure. Even painkillers sometimes reduce blood pressure. Medicines used for surgery reduces blood pressure. So all these things can reduce blood pressure. Now even some diseases, some problems, medical conditions can reduce blood pressure, including diabetes. Nerve damage from diabetes can decrease the capacity of your blood vessels to adjust with blood pressure and thereby reduce blood pressure. And changes in the heart rhythm. If there is arrhythmia, rhythm problem in your heart, then it won't be able to fill properly and therefore won't be able to pump properly. So thereby decreasing blood pressure. Now, then if you don't take enough fluids, dehydration, if you don't have enough volume of blood because of decreased amount of fluids in your diet, same, low blood pressure. That's why people faint in deserts and other things because of low blood pressure, low sugars. Then heart failure. If your heart is weak and does not pump hard enough, then you can have low blood pressure. Thyroid problems. If you're hypothyroid, then you might have low baseline blood pressure. So all these things need to be checked. So all these things have to be considered when you come to us with a history of or symptoms of low blood pressure. So you have to go through a lot of tests, including your thyroid function, ECG, echocardiography, sometimes blood tests, a proper detailed history, physical examination, everything has to be checked. Sometimes ambulatory blood pressure, regular blood pressure record needs to be kept, right? But there are certain things which you can do at your level to actually increase your blood pressure. Yeah. First thing is to drink enough fluids. Drink a lot of fluids, your blood pressure will be fine. Second, take extra salt in your diet, sodium salts. Extra sodium salts in your diet will increase your blood pressure by retaining fluids. Third, get up slowly after sitting or lying down. Don't rush up. Don't just stand instantly after lying down. That will decrease your blood pressure because the gravity starts acting and the blood gets pooled up in your legs. That's why getting up fast can lead to dizziness sometimes. That is called as orthostatic hypotension. So get up slowly. If you're lying down, then sit. Sit for 10 seconds. Then slowly stand up. Then see if you're okay. Then start walking. Right? Fourth thing which you can do is avoid drinking too much alcohol. Then don't stand for a long time. Then that can again lead to pooling of blood in the legs. Sometimes you might have to use compressive stockings so that blood does not collect in the legs. And but of course, get tested, get a consultation from a cardiologist or a physician to find out what is the reason in your case for this low blood pressure. If the reason can be pinpointed, then that can be ruled out. Then the problem can be eradicated forever. But yeah, sometimes in people who are athletic, they exercise more, their baseline heart rate and blood pressure can be low. So you have to see in which category you are, and a lot of tests and evaluation needs to be done to actually find out whether that condition is safe for you or not. But in any ways, a very low blood pressure, say less than 90 by 60, 80 by 60, 80 50, 60 40 is very dangerous. So make sure, if you have low blood pressure, to monitor your blood pressure, contact your doctor, have all your queries answered. If they don't answer, then write to us. We will try to solve all your queries here. And do write to us, how was this video and have you liked it, and how did you like my other videos. Don't forget to subscribe this channel. I'm Dr. Paramjeet, your Dr. Education.